Dr. Adrian Cole and Maya Khan thought they could hide their secret inside hospital walls. But one night in a restricted corridor changed everything forever and turned their hidden bond into a fatal mystery no one could fully explain. Dr. Adrian Cole was widely recognized as one of the most skilled heart surgeons in the country, and his reputation extended far beyond the hospital where he worked. He had built his career through years of intense training, long surgeries, and a record of successful operations that saved countless lives. Senior doctors respected him, junior staff admired him, and patients placed their full trust in his hands without hesitation. Every day, his name was associated with precision, confidence, and medical excellence. Inside the hospital, everything about him appeared controlled and disciplined. He arrived early, left late, and rarely engaged in casual conversations. His focus remained on his work, especially complex heart surgeries that required complete concentration. The hospital administration often highlighted him as an example of professional success, and his achievements were mentioned in internal meetings as a standard for others to follow. However, there were small details that did not match his perfect image. Some nurses noticed that he often spent long hours alone in restricted areas, even when his duties were finished. He avoided social gatherings organized by hospital staff and kept his personal life completely hidden. There were no known close friends among his colleagues, and no one could recall ever visiting his home. Despite his professional brilliance, there was an unexplained distance around him. It was as if he lived inside a boundary that no one was allowed to cross. This silent isolation made him respected, but also slightly mysterious to those who worked near him every day. Maya Khan worked as a healthcare worker in the post-surgery recovery unit, where patients needed constant monitoring after critical operations. Her role required patience, attention to detail, and emotional strength, because many patients were still weak and vulnerable after heart procedures. She was known among her colleagues for being reliable and calm, even during high-pressure situations. Patients often felt safe under her care because she treated them with kindness and steady professionalism. She had joined the hospital a few years earlier with strong recommendations, and she quickly adapted to the demanding environment. Unlike many others who struggled with long shifts and emotional stress, Maya managed her responsibilities with consistency. She rarely complained and often stayed beyond her duty hours if the ward was busy. This made her trusted by senior nurses and respected by doctors across different departments. Her interactions with Dr. Adrian Cole began in a strictly professional setting. She was often assigned to monitor patients who had undergone his surgeries. During routine updates and medical handovers, they exchanged necessary information about patient recovery. At first, these moments were brief and formal, focused only on medical details and progress reports. Over time, however, their schedules began to overlap more frequently during late-night shifts. The hospital became quieter during these hours, and the pressure of constant emergencies eased slightly. These repeated encounters created familiarity between them, even though their conversations remained limited to work. Maya started noticing subtle aspects of Dr. Cole's behavior that others seemed to overlook, such as his unusual silence after surgeries and his habit of staying near recovery wards longer than required. The connection between Maya Khan and Dr. Adrian Cole slowly moved beyond professional boundaries as their late-night interactions became more frequent. At first, these moments were still tied to patient updates and recovery discussions, but the setting of quiet hospital corridors and empty recovery rooms created a different atmosphere. The absence of noise and constant activity made even simple exchanges feel more personal. Over time, the distance that normally existed between a senior surgeon and a healthcare worker began to shrink in subtle ways. Their communication gradually extended beyond medical matters. Short conversations about work schedules turned into longer pauses in shared spaces after duties were completed. These meetings remained unnoticed because the hospital's night shifts were understaffed and most attention was focused on critical patients. In this environment, they found moments of privacy that did not officially exist within hospital rules. A hidden relationship started to develop, built on trust and emotional dependence rather than open acknowledgement. Both understood the risk involved, especially within a strict medical institution where professional conduct was closely monitored. Despite this awareness, they continued to meet in less supervised areas, such as storage corridors and restricted consultation rooms during late hours. As their connection deepened, they became more cautious about how they interacted in public spaces. They avoided eye contact during group meetings and maintained strict professionalism in front of other staff members. However, small changes in behavior began to appear, such as coordinated shift timing requests and unexplained absences during peak hours. These details did not attract immediate attention, but they slowly created an invisible pattern that could eventually be noticed by observant colleagues within the hospital environment. As the hidden relationship continued, the pressure inside the hospital environment began to grow heavier for both Maya Khan and Dr. Adrian Cole. What once felt manageable slowly turned into a constant source of fear. The hospital had strict policies about staff conduct, and the risk of exposure became more dangerous as routines became less predictable. New supervisors were assigned to monitor night shifts more closely, and additional security checks were introduced in restricted zones, making private meetings increasingly difficult. Dr. Cole started to show signs of mental strain. He remained professionally flawless during surgeries, but outside the operating room, he became increasingly withdrawn. He avoided unnecessary movement within the hospital and reduced his presence in common staff areas. Maya also felt the change. She began to notice that even small interactions required careful planning, and any mistake could lead to suspicion. Rumors began to circulate among some staff members. There was no direct evidence, but subtle observations such as overlapping breaks and coincidental presence in low-traffic areas created quiet speculation. The hospital environment, once predictable, started to feel tense and uncertain. Both individuals became aware that their situation was no longer just a personal secret, but a potential professional threat. This awareness created emotional pressure that neither openly discussed. Communication between them became less natural, often limited to necessary coordination rather than genuine interaction. Misunderstandings began to appear as fear replaced comfort. What once felt like a private escape within a demanding workplace now felt like a fragile situation constantly on the edge of collapse, where even a small mistake could trigger serious consequences for both of them. A late-night shift brought a situation that changed everything between Maya Khan and Dr. Adrian Cole. The hospital was unusually quiet, with most patients stable and staff moving in routine patterns. A private meeting was arranged between them in an unused maintenance section of the building, an area rarely visited except by cleaning staff. The intention was to settle the growing tension between them and decide how to distance themselves safely to avoid suspicion. Both arrived separately to avoid attention, but the emotional weight of their situation made the encounter intense from the beginning. Fear of exposure, pressure from their careers, and accumulated misunderstandings created a heavy atmosphere. The conversation quickly moved from calm discussion to emotional confrontation. Years of professional discipline could not fully control the stress that had been building inside them. In that isolated space, a sudden escalation occurred. A physical struggle followed in a moment of panic and confusion, triggered by fear rather than planning. The confined environment left no easy way to step back from the situation. Within minutes, the incident turned irreversible. One of them suffered severe injuries, collapsing inside the restricted area, while the other remained in shock, unable to immediately process the outcome. The hospital emergency system was eventually alerted, but the delay in response created further complications. Staff rushed in, but the scene provided no clear explanation of what had happened. There were no direct witnesses, and the area's limited surveillance coverage meant critical moments were not recorded. The silence of a location made the event even more difficult to understand, leaving only uncertainty behind. After the incident, hospital administration acted quickly to control the situation and prevent public attention. The priority was protecting the institution's reputation, so internal protocols were immediately activated. Senior officials restricted access to the affected area and instructed staff to avoid discussing the matter outside official channels. Security personnel were placed at key exits, and normal hospital operations continued in other wings to avoid suspicion from patients and visitors. An internal investigation team was formed within hours. Their first step was to collect statements from all staff members who were on duty that night. However, most employees only had indirect information, as the incident occurred in a restricted section with limited access. This made it difficult to build a clear timeline based on eyewitness accounts. Security footage was reviewed carefully, but investigators discovered gaps in the recording system. Certain cameras near the maintenance corridors were either inactive or did not capture the full sequence of events. This missing data created confusion and slowed down the process of determining exactly what had happened. As days passed, different interpretations began to emerge within the hospital. Some staff believed it was a sudden accident caused by emotional distress, while others suspected intentional harm due to the unusual circumstances. The lack of clear evidence allowed rumors to grow, increasing tension among employees. Investigators also examined communication records, shift schedules, and access logs to identify patterns. These records showed irregular movement between restricted zones, but nothing that could fully explain the final outcome. The absence of direct proof left the case open to speculation, making it one of the most complicated internal investigations the hospital had ever faced. After weeks of internal review, the hospital administration reached a conclusion that aimed to close the case quietly while avoiding external scrutiny. The investigation could not establish a fully verified sequence of events due to missing surveillance footage and limited eyewitness presence. As a result, the final report focused on a combination of emotional stress, workplace pressure, and restricted environment conditions as contributing factors. The official outcome described the incident as a tragic escalation that occurred behind closed hospital doors, rather than a premeditated act. Both individuals' professional records were reviewed and later sealed within internal archives, preventing further public access. The hospital also issued internal directives to ensure that similar situations would be avoided in the future through stricter monitoring of restricted areas and improved staff supervision during night shifts. Despite the official closure, uncertainty remained among employees. Many staff members continued to discuss the event in private conversations, especially because key details were never fully clarified. The absence of a definitive explanation left space for ongoing speculation, and different versions of the story circulated quietly within hospital walls. Over time, the hospital returned to normal operations, but the atmosphere changed. Security was increased, access to certain areas was reduced, and staff interactions became more formal. The incident became an unspoken warning about hidden relationships and emotional pressure within high-stress medical environments. For those who worked during that period, the memory of what happened never fully faded. The case remained locked in internal records, but its impact lingered in the behavior and caution of the staff. It became a silent reminder that even in a place dedicated to saving lives, hidden emotions could lead to irreversible consequences.